Guys, so I recently signed up for Talkiatry to try out their online psychiatry services, and I pretty much in this video I'm just going to be going over the enrolling process with Talkiatry, selecting a service that's best for you, scheduling your first appointment, and ultimately just finding what Talkiatry may provide that would be the best fit for you. Talkiatry is an online psychiatry service that pretty much specializes in the diagnosis and treatment of certain mental health conditions, and they also provide medication management as well online. Some of these mental health conditions include ADHD, depression, anxiety, OCD, and this psychiatry online service is one of the few that does provide psychiatry online services to pretty much all ages. You just have to be 5 years or older, and if you are 5 years old, they have an option for you, which is really, really cool. This definitely stands out as an exceptional feature for me just because most psychiatric services, you have to be at least 18 years or older for them to be able to give you service. So that's definitely a really cool thing that they provide, and it's super easy to access Talkiatry. You pretty much just can go on a web browser or you can download their mobile phone app. As a note though, as of June 2023, Talkiatry actually uses a third-party app. They don't have their own app, so they actually use a third-party app called Helo or Hello. I'm not sure how you say it, but it's spelled Healow. So you can pretty much just access that through the App Store. Download that. This may change in the future, but as of now, you can access Talkiatry through there. When you first go to the website, you're prompted to take a free assessment, which pretty much just goes into your medical background, your goals that you may have with Talkiatry, just kind of gets a sense of what you're looking for and how they can help you best. And then the Talkiatry team will actually pair you with a psychiatrist that, goes well with your schedule, your goals, your personal needs. And from there, you can pretty much schedule your first appointment. From there, you'll have your first virtual visit and pretty much start the process of getting diagnosed, receiving medication, and ultimately just establishing a relationship with your psychiatrist. The care is highly individualized as you do meet with the same doctor every single time, and I just wanted to emphasize as well that the Talkiatry team of psychiatrists really says that it is a judgment-free zone. There is never any judgment, and they just really want to make it a safe place. Even though they do feature licensed therapists with Talkiatry, it's only in collaboration with their psychiatrist on their team. So ultimately, if you're just looking for virtual therapy care, online therapy as a standalone service, I don't suggest that you try Talkiatry. I think a better fit honestly would be BetterHelp, which you can look at my BetterHelp review as well that I did. As a note as well, you can only sign up for Talkiatry if you have an in-network insurance plan. So they do prompt you when first going on there just to make sure, before setting up your first call or anything, that you do have an in-network insurance plan, as you cannot sign up for Talkiatry if you don't. Along with that though, they pretty much take majority insurance providers, but they do just say, to check at first before signing up. Then you just have to confirm that your insurance is covered by their platform, and the cost at that point, if it's covered, just depends on where you live, the type of coverage and plan that you have. And they do cover right now 43 states in America, but the platform Talkiatry is really, really trying to expand and go to all 50 states. After matching with a psychiatrist, communication can begin. The first evaluation is 60 minutes long and the follow-ups are 30 minutes long. Evenings and weekends are available for appointments, and pretty much after you sign up, you can expect to get your first appointment booked within about 5 days or less. If your provider decides that you would benefit from medication, then they will send, your prescription to your local pharmacy. You can go pick it up. You can choose to use your insurance. If you have that coverage, all that jazz, or you can choose to pay out of pocket, up to you. Talkiatry psychiatric providers can provide medication for insomnia, depression, anxiety. Talkiatry providers may prescribe stimulants and non-stimulants for people with ADHD, medication management. It just depends on your provider and what state you are in, whether it's an option for you. Different states have different policies. As of, July 2023, this is the policy. A big difference with Talkiatry is that they do provide, medication management services to kids and teenagers, which is honestly very rare for a psychiatry provider to, have such an expansive option of medication management services for, kids and teenagers. It's really, really cool that they provide that, and it's puts them in a standalone category for that service because there's a lot of psychiatry providers, but not a lot that, provide services to kids and teenagers. Like I said, it's usually about 18 years or older. Overall with Talkiatry, I really enjoyed my first session. It wasn't, super beneficial for me though, because at this time I'm not looking for medication management. But I just wanted to sign up and just see firsthand, how smooth the enrolling process was and what the whole Talkiatry experience was about. It was really nice that they took insurance like a routine health visit, In general, I think it's a really great thing, as most other places you just pay out of pocket. So if you do have insurance coverage, I think it's a really great option for you. I wouldn't recommend Talkiatry for anyone who's just looking for talk therapy, as they mostly specialize in, psychiatry and the diagnosis and treatment of mental health conditions. Also, if you're not looking for medication management, Talkiatry I don't think would be the best fit, as well as if you don't have insurance. Talkiatry may not be the best option for you if you have severe symptoms requiring in-person supervision, you are not open to taking medication, looking for treatment for schizophrenia, primary eating disorder treatment, or medication-assisted treatment for substance use disorders. If you don't have insurance, you are looking for talk therapy only.